Hello everyone. Today we'll discuss another important MCQ from the general pharmacology. Okay, the question is: a 32-year-old male patient develops anaphylactic shock. Okay, and was given injection adrenaline 1 is to 1000 by intramuscular route. Okay, and the actions of histamine, okay, in this case are antagonized by the adrenaline. Okay, so what type of antagonism is seen between adrenaline and histamine? Okay, option number 1, chemical antagonism; 2, competitive antagonism; and number 3, non-competitive antagonism; and fourth one is physiological antagonism. Okay, so this anaphylactic shock, it is a type 1 hypersensitivity reaction. It occurs following administration of penicillin group and even cephalosporins group of antibodies. That is the most common. So they have given adrenaline 1 is to 1000 by intramuscular route. That is a life-saving drug. But here the question is, what type of antagonism is seen between the adrenaline and histamine? Okay. First one, the option is chemical antagonism. Here the classical example for this is heparin. It is a parenteral anticoagulant, so it is an acid. It is, in case of heparin overdose, will give protamine sulfate. This is the specific antidote, so neutralization occurs. So heparin is an strongest organic acid present in the body. Okay, and it is neutralized by the base called protamine sulfate. So neutralization takes place. So the here it is example for chemical antagonism. Okay, so next one is competitive antagonism. Here both agonist and antagonist compete for each other for same site. That is, agonist and antagonist binds to the same site of the receptor. Okay, there is a competition between the agonist and antagonist. Okay, so in competitive antagonism, there is a right parallel shift, okay, in log dose response curve, and efficacy remains same. So in case of non-competitive antagonism, there is no competition between agonist and antagonist. Here agonist binds to the one side and antagonist binds to the another side. So agonist and antagonist, they are chemically unrelated, and they are binds to the different site of the receptors and produces non-competitive antagonism. Okay, so here the example is in case of diazepam benzodiazepine, and it is antagonized by bicuculline. This bicuculline binds to the another site, that is convalescent site, and diazepam, it binds to the GABA A receptor and it produces anticonvulsant activity. So this is the example for non-competitive antagonism. Here flattening of the curve occurs. Because of this decreases efficacy. Okay, flattening means efficacy is decreased. So the option 4 is called physiological antagonism. So the classical example here, adrenaline and histamine. What is meant by physiological antagonism? That is, two drugs act on two different receptors. Here adrenaline acts on, okay, that is beta 2 and produces bronchodilation, and histamine acts on H1 receptors and produces bronchoconstrictions. So these two drugs acts on two different receptors of the same system and produces opposite actions. Okay, so this is called physiological antagonism. So in this case, the adrenaline antagonizes the actions of histamine, okay, and it produces bronchodilation and also increases blood pressure. So here option number 4, physiological antagonism, is the answer in this case. Okay, so it is also known as functional antagonism. Sometimes they will ask, instead of physiological antagonism, they will ask functional antagonism. So you have to know the other name of this antagonism. Okay, thank you all.